Hello, I'm Dr. Tarun Reddy, orthopedic surgeon, specialist in knee and shoulder surgery. Today I would like to discuss about ACL or anterior cruciate ligament injury. Of the four major stabilizing ligaments of the knee, ACL is the most commonly injured ligament. It is most commonly seen in sportsperson of pivoting sports like kabaddi, basketball, volleyball or football. It can also be seen in road traffic accidents or seen in trivial traumas in elderly people. The classical mode of presentation would be a twisting injury to the knee while an eccentric force is thrust on the knee and the foot is fixed onto the ground in a mildly flexed position. Classically, the patient experiences severe pain following the knee and may hear a popping sound during the injury. Although the pain is not as severe as fracture, most often the patient requires an assistance to be carried off the field. The swelling will be set in the first 3 to 4 hours. Initial radiographs might reveal nothing or may reveal a simple chip fracture or an avulsion fracture around the knee. In the settings of chronic injury, that is, if the patient is carrying the ACL injury for more than a month or two, the classical presentation would be instability. That is, whenever the patient tries to walk briskly or jog or run, the patient experiences some buckling of the knee or giving away of the knee. The patient will not have as much confidence in his injured knee when compared to his uninjured knee. So what happens if an ACL injury is not treated? In other words, what is the natural course of an ACL injury? So in the deficiency of an ACL, that is an ACL deficient knee, the structures in the back of the knee tries to recompensate or tries to take up the function of an ACL. Because of this, the structures will be slowly stretched out and will be injured. Once enough structures of your knee are injured, a gross instability will set in your knee. So what happens if a gross instability of a knee happens? All the injuries of the knee dials down to cartilage injury. Your instability results in small injury to your cartilage. Once all the small injuries gets added up, a massive injury to your cartilage happens. Once enough amount of your cartilage is destroyed, there is no other way to repair your knee than to do a replacement. Although there are several proven and unproven cartilage repair procedures, only a few of all of them are focused on maintaining a single isolated or segregated cartilage injury. None of these procedures are valid for a gross or massive cartilage injuries. So an ACL surgery is a classical stitch in time saves 9 kind of a procedure. Next question. Does all ACL injuries require surgery? In a simple word, no. Not all ACL injuries require surgery because an ACL injury can range from simple sprain to a complete rupture of ACL. So in most of the simple sprains or even in some cases of partial bundle tears, conservative management of an injury can be done with closely monitored individualized physiotherapy. In the case of a complete rupture, ACL surgery should be done in order to avoid further complications of an ACL deficient knee. How does an ACL surgery is done? In current orthopedic scenarios, almost all the ACL surgeries are done arthroscopically or a keyhole surgery. It classically involves having 2 small incisions in the front of your knee, less than 0.5 centimeters, through one of which an angled scope attached to a camera will be passed through in order to gain a direct visualization of your knee structures. Through other instrumentation will be passed to repair or reconstruct your knee. Given the minimal impact and low invasiveness of the arthroscopic surgery, the rehabilitation and the postoperative pain will be minimal when compared to an open procedure. In the setting of a graft choice, it should be individualized to every patient. It can be a bone and a tendon graft or it can be simple soft tissue graft. They should be individualized based on patient's activity or several other factors. They should only be come to a decision after an exhaustive discussion with your surgeon. Next is most common question I get asked. How long would it take to recover from an ACL surgery? In terms of rehabilitation, normal ACL surgery or 2 weeks after ACL surgery will be focused on regaining your range of movement. The next 4 to 6 weeks will be focused on strengthening your muscles, followed by regaining of complex movements and return to sport. Normally this entire process would take around 6 months. But if you're talking in terms of return to work, if your work involves a desk job or a minimal manual activity and you can avoid a public transport to go to work, you can go to work as soon as 10 to 14 days with the help of some orthosis. So what is the success rate of ACL surgery, you might ask me? In the hands of a skilled surgeon, given the modern instrumentation and techniques, the success rate is around 90 to 95%. In simple words, almost all the patients who undergo ACL repair or reconstruction for their ACL injury will get back to their original pre-injury level of activity. course. All said and done, rehabilitation and physiotherapy plays a very important role in the recovery or rehabilitation process of your ACL injury. So the patient should be absolutely compliant with the advices of the surgeon and the physiotherapist to regain the maximum activity. So I think I've scratched the surface of ACL injury and ACL surgery, but if you have any doubts, you can contact us through the information displayed on the screen. My team and I would be very happy to clear your doubts. Thank you. Have a great day.